Is Arby's your new favorite steakhouse?
Arby's, we have the meats.
Goodwill, good for the planet and our community for 100 years.
Well, we're going to give a big Chattanooga welcome this morning. At least I think we are. Dr. Adam Caputo is here this morning. He is with the Spine Surgery Associates at Parkridge Hospital, but he's helping to be part of the welcoming committee for Dr. Graham Albert, who has been in town now for 2 weeks.
Yes, ma'am.
Do I have that right? So y'all are making a dynamic team. Good to have you both.
Happy to be here.
Thanks for having us.
So, you know, I think it's fair to say, Adam, that probably anybody who has to face a problem with their spine, whether it's their back or their neck, they begin to network a lot, talk to friends a lot, and they say, who do you know who's good? People are very afraid of having to go through surgery unnecessarily. Fair?
Absolutely, yeah, especially for the spine.
Yeah. So I mentioned the spine and the neck. Does a lower back problem sometimes have a starting point in the neck and you might not know it?
Sure, yeah. So, I mean, the spine is a coordinated structure where issues in one area can definitely affect an issue in the other area. And a lot of the patients we see will have pains that migrate from their neck to their lower back and things that, symptoms that can really inhibit their quality of life.
Yeah, but both of you are tackling those issues surgically. Y'all are not the non-surgical option. You are going to be the surgeons in the OR working the magic, and yet you come, Graham, with kind of some new techniques that you're looking into doing endoscopic procedures now, right?
Yes, ma'am. Yes, ma'am. So Spine Surgery Associates, we do try to be as minimally invasive as possible. Endoscopic spine surgery over the last 20 years or so has really taken off, and it allows us to be even more minimally invasive, smaller incisions, quicker recovery. So I'm very much interested in that.
When people come to you, is it hard for you to know how to gauge the pain a person is in? Has got to be very difficult. I saw your eyes get big.
Yeah, I mean, pain's perceived different by everybody. I mean, I think the thing we look for the most is how it's affecting their quality of life. So we can ask for pain scores, numbers, and such, but really I think the questions that both of us like to ask are things more along the lines of, what can you not do because of this? What events have you missed with your family? What events have you missed? Hobbies that you love doing, things like that. So
right.
It's more of a functional question of, how is this affecting your life? And then we look to improve things so they can do those things again.
So what types of procedures are we talking about? Are we talking fusions? Are we talking ablations? What are we talking?
Well, ideally we can avoid a fusion in a lot of scenarios. For example, if you have sciatica, pain shooting from your lower back down your leg, and you really don't have that much back pain, my first choice would be to take pressure off the nerves with just a decompression surgery. We can get into the weeds, but certainly fusions is something that we do both in the cervical spine and in the lumbar spine typically. But it's not our first choice.
So you hear about decompression sometimes on the chiropractic side, but I didn't think about it being a decompression surgery. Is the recovery from that pretty quick, or are you out of it for a little while?
Compared to a fusion, it certainly is quicker. As opposed to 6 months to really feel great again, it might be closer to 6 weeks.
Wow.
Yeah.
On the sciatica, for example, is that something that is just going to happen for some people just unpredictably, or are there things that we're doing that contribute to developing that?
So what I think a lot of people don't understand is that as we all age, we all get some element of arthritis. Bone spurs in our back, disc bulges, disc herniations, slip discs, and all these things can put pressure on our nerves. Some people's brains may pick that up and say, oh wow, that's painful. Some people, they might get lucky and never know about it. Who gets affected, who has symptoms, we're not really sure how to predict that. I would say the most important thing about preventing something like that from happening is staying active and focusing on your overall health as well with diet, exercise, good social relationships.
Is it important for you to know, Adam, if you were, let's say you were the high school athlete and now you're in your 40s and you're still pounding the pavement running or something. Is it possible if you had an injury in your earlier years, it could lead to problems as you age?
Yeah, absolutely. I mean, I think the analogy I think of usually is just like treads on the tire of a car. So you get a set of tires, there's not a way to, grow the treads back. And as you go through life and you put miles on the car, you're going to wear those treads off. And it may be that there's certain times in your life where you drove it harder than others. And, high school injuries, car accidents,
Right.
Just a job where you're working hard, these things all can accelerate the wear and tear.
What about this little guy right here and walking around like that? Are we all developing some neck issues, do you think? You both laughed a little.
Absolutely. Okay,
Yeah, yeah. I'd say staring at your phone uninterrupted for long periods of time is certainly one of the culprits that we see frequently. You'll hear people say there's no such thing as bad posture, meaning it's okay to look down and do things, but you gotta mix it up.
Yeah.
For example, sitting on the couch for 3 hours uninterrupted, not something we'd recommend. If you're gonna sit and watch a 3-hour movie, we'd recommend maybe getting up once every 30 minutes and taking a walk around the house or around the block. So mix it up, mix up the postures, right?
All right.
Yeah.
Well, welcome to Chattanooga. We're
Thank
very
you
glad
so
that you're
much.
here. And if people want to reach out to you about making an appointment, do you know if y'all require a referral or can they self-refer? Do you know?
It just depends on the insurance.
Okay.
Definitely, you can just give our group a call and we'll sort through everything for you.
Well, here's where you'll find them. Spine Surgery Associates at Parkridge Health System on Gun Barrel. 423-756-6623 is how you can place that call. And then online, parkridgemedicalgroup.com. I'm sitting up straight.
Not all injury lawyers are the same. The lawyer you choose can make a big difference in how much money you get. Big insurance companies know the insiders, and when we take your case, we expect to win big. Call us.